We want to vaccinate only healthy pets. We do not want to be vaccinating dogs that have ear infections, skin disease, don't feel good, have chronic GI issues, have cancer, like have dental, or having an anesthetic procedure, that are stressed. That is not an ideal pet to be vaccinating. So what is vaccinosis? Vaccinosis is a state of energetic imbalance and mild to life-threatening illness occurring after an animal or person receives administration of an immune system stimulating substance, so like a vaccine. It's not technically a true diagnosis, but it's a term that's familiar to the general public and practitioners in holistic medicine, the holistic community. Your pet might feel lethargic, have a high body temperature, decreased appetite, low blood pressure, vomiting. Those are going to be more of like a hypersensitivity, acute anaphylactic type reaction if that's occurring. But your pets might not show really obvious side effects. And so this is why we need to vaccinate only healthy pets. What may happen is we run blood work after a pet has been vaccinated, and we find their kidney values are a little bit elevated or their liver is a little bit elevated. Now we have to question, are these related to the vaccine, and are we seeing this vaccinosis state? So how do we prevent this? We want to vaccinate only healthy pets. We do not want to be vaccinating dogs that have ear infections, skin disease, don't feel good, have chronic GI issues, have cancer, have dental, or having an anesthetic procedure, that are stressed. That is not an ideal pet to be vaccinating. We need to be separating out the vaccines, so we're not giving 15 different vaccines. There could potentially be like 15 vaccines that your puppy could receive based on the amount of vaccines that are present. It's insane. So we need to be separating out these vaccines. We need to be looking at the lifestyle of your pet and vaccinating according to the risk. Don't just give Lyme just to give Lyme because the vet has Lyme. Don't just give lepto to give lepto because your veterinary clinic has lepto. Ask for the information. Ask, what is the risk to my pet? Give me the science behind it. And then do titers. We need to be titering so that we know where our pet's immune status is. It's the thing we can do. So we need to be doing that more frequently. Ask your vets. The more we ask, the more things can change. That's so important. We did a lot of titer testing at my last vet clinic, and that's abnormal. I find, like with my previous vet clinics I worked at, we didn't do titer testing, and I wish we had. And making sure we're using the safer vaccines, using the adjuvant-free, using the lower dose vaccinations, thimerosal-free vaccines. Let's talk about some side effects, because there can be quite a few, right? So a 2005 study in JAVMA showed that 1 in 250 canine patients had some form of post-vaccination reaction. So about 13 reactions per 10,000 vaccines given. So not a huge number, right? However, if it's your pet, that's all that matters, right? I don't care what the number is, but when it's your pet, it makes a difference. Dogs most at risk are small breed, young, 1 to 3 years of age, and for some reason, neutered male dogs. Same with cats. Multiple vaccines administered in one setting, that correlated with a higher risk of adverse response. So this is splitting them up. Coming back in 2 weeks, 2 to 3 weeks, getting the other one, breaking apart those vaccines, asking for the monovalent distemper, asking for the monovalent parvo vaccine so that you're not combining everything and giving everything together. The majority of reactions occurred the same day of vaccine. So this is really important. I find like we are in a stressful environment right now, right? No one wants to be in the vet clinic. So you want to get things done, get it over with, get out. When you're getting your pets vaccinated, take your time. I'd say at least 15 minutes. You want to be there from the time of vaccine to at least 15 minutes before you get in your car and leave. Because if we see those acute anaphylactic reactions, it's going to occur within that time frame, and you will want to be at the vet clinic because your pet will need care so they don't die. That's how serious those are. I've seen them. I've had to treat pets with that. And thank goodness it's not super common, but that's very important to know. Most of those reactions are going to be they're lethargic, they're tired, they're sore where the vaccine was given. And then they found multivalent vaccines didn't correlate with more reactions. So this would be like your distemper parvo combination, some of the Bordetella vaccines, keeping in mind lepto is combined with distemper and parvo for a lot of those vaccines. And lepto is number 2, just under rabies for vaccine reactions. And as I was researching different companies, there are also cat vaccines that include everything, including rabies. So imagine that, like everything going into that pet. So all at the same time. And then remember, rabies and lepto have the most adverse reactions for those vaccines. Hey pet parents, I hope you enjoyed this video. If you did, would you please hit the subscribe button below and post any questions you have down below. Also, if you'd like to join us on our next live training to learn more about holistic health in your pets, then click the link to join our Natural Pet Tribe to gain access to live videos every month with me and the ability to ask me questions. I'd love to give you more education and interaction to help your pets thrive naturally. Until next time, please subscribe and share this video with other pet parents that may need help and guidance to help their furry family members live a long and vibrant life. Thanks again for being a part of our community.